Hello everybody, and welcome to the menopause side of YouTube. Welcome back to my channel, Millennial and Menopause. This month is March and it is Endometriosis Awareness Month. And every once in a while, I like to share my endometriosis story. Say that 10 times fast. I like to share my endometriosis story every once in a while, just to give it a fresh review. Right? On my Instagram, I posted an image to share my support in Endometriosis Awareness Month. So in this post, there's a photo that I've never shared before, and I never really discussed this ever before when it came to talking about my endometriosis journey. And that is the photo of my ostomy. I did not have my ostomy for very long, but it was a really, for me, traumatic, scary, and just difficult time in my life. The whole endometriosis journey, but also the trauma with my hysterectomy was a lot. If you've been subscribed to my channel since 2018 or been following me on Instagram, most of you would probably know my story. But for those who don't know, and if you didn't see my original video about my menopause story, which was a little bit longer, so I'm hoping to condense this a little bit more. So we're kind of going to move through my timeline a little quickly up until like my hysterectomy. So I started my menstrual at 9 years old. And at the age of 10 is when I really started to experience severe pain. I went to the pediatrician. My mom took me to the pediatrician, and the pediatrician informed us that more than likely it's because I'm new to the whole menstrual cycle community gang, and it's kind of normal for me to feel pain until my body gets used to it. That was crap. But anyway, my mom didn't know, and neither did I. We're listening to the doctors. This is what we do, right? Another video for another day. I do recall during that appointment that the doctor did ask my mom if anyone else in our family experienced cramping during that time of the month. And my mom did share with her my aunt had those issues. And then I guess proceeded to ask her if my aunt still has issues, and she said no. So the doctor just alluded, maybe it's something that will go away as I get older. Like I'll get used to the cramping, or it won't be as severe for like the rest of my life. That was a lie. But anyhow, so moving on to my teenage years, I still continue to experience severe cramping. The first 2 days were my worst. So the first day was my worst. The second day was like, it's bad, but I couldn't stay home from school too long. So my first day was the longest day. The first day was the day that I would stay home from school or either get picked up. Sometimes the second day I'd have to call my mom to come pick me up as well, but either way she would pick me up with no questions asked, because there are days that she'd pick me up anyway, no matter what, because she already knew what was going on with me. I will say I was quite active in school, elementary and in middle school, because of PE and different activities. And so as I think back of the different times where my cramping got worse, I would say that in elementary school and middle school, although bad, they weren't as bad as by the time I got to like high school and college. And I would say, yeah, high school and college. So I was pretty active, and I don't know if this is a researched thing, but I noticed for myself, being more active, exercising, things like that, my cramps were still bad, but I could tell the difference between my active lifestyle and not being active when it came to the severity of my cramps. Does that mean that they weren't as equally as bad? They were bad, but I could tell the difference, if that makes sense. Somebody's following me here. I don't know who, but somebody's following me. You get it. Okay, so in high school, I was in marching band, and so we were very active. We had to work out before, well, somewhat work out. We ran, we would come back in, we'd march, of course, but, and then we had dance, then we had to learn our dance routines. So it was active. It wasn't as active as I was in middle school, but it was active. And we had this ongoing, but I still experienced bad cramps. So there would be days where I would still go to practice, but then I'd have to sit out, or I'd make sure to take my dose of Advil before practice, just to keep up and keep myself going. It was rough, but I had to keep myself going. When I got to college is when my menstrual, it was bad. The cramps, everything was bad. I do recall getting sick. I would have moments of nausea and vomiting in high school, but in college it was almost certain that every month, no matter what, I would get sick. I would take my heating pad to school with me. And so when I was between classes and I had like a long break, whether it be 30, 45 minutes to an hour, I would go to the library in one of the chorale rooms, and I plug in my heating pad and I put chairs together and I'd lay there and go to sleep until it was time for me to go to my next class. And I made sure I had to have hot tea. I could not eat certain foods. So that is where I really could tell the difference in my body. High school, I don't think it necessarily connected with me in high school about what to eat and what not to eat. I always drank hot tea though my first day, always. And my mom's gave me hot tea from the time I was little, when I first had my cramps. She passed away when I was 15, so I kind of was like left out in the dark on my own. So I was managing myself. I was managing by myself. My dad, he helped where he could, did what he could, but it wasn't as like that mommy feeling, mommy rubbing you down and, helping you out. It was a little different. So in college, I did move in with family. I moved with my aunt, her husband, and children. So I was around family, but again, when you're in another environment with people who really don't know your story or know what you've been going through literally your whole life, it's a little bit different. My aunt didn't quite understand what was going on, and I will say, even my grandmother lived, so I'm in South Florida, I moved to Jacksonville, but even with my grandmother, she didn't understand my cramping, like how bad and severe it was for me. So they weren't aware of it, and sometimes thought that I was trying to get out of like washing dishes and different chores, but that was not the case, y'all. I was really in pain. If you know, you just know. And I would always say, can I get 30 minutes? Because I knew there was a point in time where it only took me 30 minutes from the time I took my Advil, so the Advil would be able to kick in. So I would take, I upped my doses to like 4 Advil, so that's what, 800 milligrams. It was 800 milligrams every 8 hours, sometimes 7, every 7 hours. So I would do 800 milligrams and it would take me about 30 minutes. The longest it ever took was like 45 minutes. It all depends on when I caught the cramping, like that time frame. There's a time frame, and you know what I'm talking about. So I would feel kind of bad because I'm like, yo, I'm really sick. Like, I'm not faking. I'm trying to explain how I'm not faking. This is real. On my way to school, sometimes I would throw up. I would have to pull over and throw up before I get to school. It was pretty bad. And I noticed that I couldn't have greasy foods, so no hamburgers. I couldn't have fried foods. Um, at some point, I couldn't eat chicken during my menstrual cycle. So I would eat chicken, whether it be baked or fried, boiled, whatever. I could not eat chicken. I would immediately, it would come right back up. And I thought that very strange. So back in the early, this was pretty much the early 2000s. I graduated in 2000. So this was the early 2000s, and Google was just coming around. YouTube was not quite a thing. It was, but there were only like 10-minute videos. I don't even know. But it was not much research that I could do about what was happening to me. So I Googled like my symptoms and different things. And one day I came across endometriosis, the term endometriosis. And I was like, wow, it sounds like endometriosis. Back then, up until about 2020 or 2021, when someone called them out on it, I can't remember what year it was. Okay. Back in that time, I came across different websites and different, just like, I guess, articles. And a lot of the articles indicated that women who have endometriosis are white. So for me, I was like, well, it can't be endometriosis because I'm not white, you know? But I have the symptoms. Maybe it could be something else. But endometriosis stuck in my head for me. It stuck in my head, and I was like, okay, maybe this is what it is. Maybe I'm like the one black person that has it. I don't know, because I've never heard of it before. I didn't know there was a thing. At one point, I was like, is it uterine cancer? I thought so many different things because the symptoms could range from having anything. Anyway, all through my college experience, which was not a college experience, it actually was more like I honestly should have gotten a degree, an honorary degree in for medical school. Honestly, I spent a lot of time at doctors' offices, getting scans, getting blood work, all the things. So my aunt took me to a gyno. My first time going, I was 21 or 20. I think I was 20. I was 20, first time going. She was like, you got to get this checked out. Something isn't right. So I go and I'm explaining to him. He's not really sure what's going on. I'm having kidney pain on my side. And it's just, I can't function. I'm missing a lot of classes, trying to make up work that I miss, explaining to professors that I'm unwell, and I'm not just missing classes, and I'm going to try to make up the work. And I'm pretty much failing, basically. So I go to this doctor. He does a pap smear. The pap smear comes back fine. So I'm like, okay. So then he does an ultrasound. I had an ultrasound, CAT scan, chest x-ray. I had all the things, right? And then he says there's a mass on my ovary. So he says we're going to have surgery. So I have surgery, and I wake up and I'm still in the hospital, confused. Why am I still here? So apparently I had a chocolate cyst on my right ovary that was the size of a golf ball, so it couldn't be removed. Normally it was supposed to be outpatient, so he was going to be able to, what's the term? Because I don't want to say deflate, but extract, the fluid from the cyst to be able to remove it. So it went from being a laparoscopic surgery to a cesarean cut surgery. So I had that done. He said I had adhesion, so I had adhesions from adenomyosis, so he gave me names. And he told me I had endometriosis. And I was like, whoa. It was a light bulb moment. It was like, I won't say light bulb moment, but it was a more freeing moment to have a name for what I was going through. And so my next question was, so how are we going to fix this? Because I don't, let's not have this again. So during that surgery, this was his first time dealing with endometriosis, by the way. He was really, really nice in just informing me that he's never dealt with this before, but he's going to confer with some of his colleagues regarding endometriosis. So he said he had packed my abdomen was a little extended, and he said that's because he put some type of jelly in there to help with the cooling down the adenomyosis. And then I had to go on a shot called the Lupron Depot shot. Now, if you want to watch a video, that's my most watched video, I believe, about the Lupron Depot shot. So go on over there after this video and watch that. I tell you all about that shot. So I had the Lupron Depot shot for that, and I was on that for 6 months, and that stopped my period. So I did not have a period during the time of my recovery. It's supposed to help me recover. So I went back to classes, tried to pick up where I left off, all the things. Unfortunately, during this time, I had to withdraw from classes. I actually did not go back to classes. I actually had to withdraw from the entire semester, and I withdrew. I didn't go back for 2 semesters because of my recovery, and the classes that I need to pick back up were big classes, and I didn't want to do that summer term. So I had to sit out for 2 semesters. Not what I had in mind. I wanted to graduate in 2004 the way that I should have, but I didn't. But anyhow, I digress. So after my surgery, so I'll say after my last Lupron shot, it took until my next period after the shot. It actually went pretty okay. I cramped, but it was to me like a normal cramping. I didn't get sick. I wasn't debilitated. I wasn't crawling on the floor. I didn't lay down in the middle of the floor. I didn't tell anybody you can't touch me. And those were just some of the things that I had to experience, but I was actually fine. My second menstrual, however, after was the worst. I literally woke up vomiting, went in the bathroom, and I vomited. My aunt woke up. It was the middle of the night. She came in and she was like, "Are you okay? What's going on?" And I just started crying. And I said, "It's back. It's back." And she was like, "No." She was like, "But you had this surgery." And I just was crying. And I went back to the gyno to let him know what was going on. And he was just like, "I don't know what to do." But that's when I went on birth control pills. He put me on birth control pills before. That didn't work. When I first went to him, prior to my surgery, he put me on birth control pills. They didn't work. So he said, all I can do is try another birth control pill. And he put me on the one at the time. It was called Loestrin FE. I don't even know if they have that anymore. But that one is just taking all of the active pills and not the inactive ones. So what happens is you don't have a period. You have a period 3 times a year, I think it is. I think that's what it is. So I was on birth control pills for some period of time. I stopped taking them because I couldn't afford it. I couldn't afford it. So I just stopped taking them, and I was just like, even when I have my period, I still have bad cramps anyway. So it's just like, I don't even know if there's a point in it. 2, I started reading a lot. I did more research on birth control pills, and I was just like, maybe this isn't the best thing for me to take. So I was just like, hey, we're just not going to take it anymore. I graduated in 2006, and then I moved back to South Florida. I tried looking for gynos, and that was the worst experience one of the worst experiences ever. I ended up stopping my experience because I was gaslitten, and people were telling me, I had doctors tell me that just because I had surgery doesn't mean, or just because I had a cyst, it doesn't mean that I had endometriosis. They were telling me, oh, what your experience is normal. Everyone has cramps. It's just that some people have a low pain tolerance. Okay. Yeah. So I stopped going to a gyno for 7 years. Yep, for about 7 years. And I was okay with that because I said, well, if this is something that I have to live with, I'd rather just deal with it and not have to deal with going to the gyno all the time. So I stopped going to the gyno. What was the point? I have endometriosis. Obviously, nobody can help me. So I just stopped going. 2012 is when I noticed my body behaving the way that it did when I was in college. So not being able to eat certain foods, vomiting a lot during that time, and I just couldn't handle it. I was at work, I would bring my heating pad to work. You couldn't call out like that because, PTO. I was like, dang, that's so 2012. I am at home and I am watching television. It's late night. I'm watching television and I see something come across my screen about this doctor's office who specializes in endometriosis. And I'm like, what? So I quickly grab a pen and paper, write the number down, and I call the next day. So I call, schedule an appointment. And at this moment, when I go for my appointment, I'm terrified. And I'm like, if this person is like everybody else, then that's it for me. I'm never going to find a doctor, and I'm not going out to search for one. So I get to the doctor's office and I'm sitting there. Comes in, he introduces himself, and he asks me what brings me here. Okay. So I tell him my experience. This is where in other doctor's offices, it goes left real quick. But this time, he says that he turns and looks at me and he says, I'm just typing my notes in the computer because I'm typing what you're saying to me, and I'm looking over a couple of things. I'm looking at what you wrote in your paperwork. So I said, okay. He said, so, but I'm listening to you. And I said, okay. So I tell him everything, what I'm experiencing, and he stops typing and he looks and he says, it sounds like endometriosis to me. So he says, what we're going to do here is I'm going to do a pap smear, do a pelvic exam, whatever, pelvic exam. So I was like, okay. So he does the exam or whatever, and he says, okay. He was like, yeah, it's definitely endometriosis. He was like, but he was like, I know more cases. I know a lot about endometriosis. Like, he specializes in it. He was like, I don't want to make assumptions, but what I am feeling is, he said, what I'm feeling clearly feels like endometriosis. So we talk about it. So he does other exams, and he says, okay, so we need to have surgery immediately. Like, we have to have surgery basically. So I have the first surgery with him in 2012. That surgery, he says, your endometriosis is severe. He was like, it's at stage 4. So I'm like, first of all, didn't know they had stages, unaware. So I'm like, okay, so what can we do? He was like, because of your age, he was like, are you dating? Are you married? Are you dating? And no. And so he's like, are you planning on having children? I said, yes, I would love to have children. He was like, okay. He was like, I have to be honest with you. If you want to have children, you have to have children sooner than later because what it looks like, he was like, I can do what I can. He was like, this first surgery, I cleaned up as much as I can, but I need to clean up even more in order to see the viability of your ovaries, your eggs, and your uterus to see what things are looking like, right? In that first surgery, with that first surgery, remember I told you my kidneys was hurting? So basically, endometriosis was wrapped around my kidney and was pulling my kidneys out of place. Okay. All that pain that I was feeling, pulling my kidneys out of place. And all the other doctors, because I've been to urologists, I've been everywhere. And they're like, oh, you're fine. Your kidneys are fine. Everything's fine. Everything looks good. But again, I understand that you can't really find out too many things until you actually go in. But I just found that to be really crazy. This is how bad endometriosis is. And I think now people are getting that, but some people are getting that. Some doctors are getting that. Which is why I always say find a doctor who specializes. Not every gyno is specialized or knows about endometriosis, and they may know about it, but never have had an experience with it, a patient with it. And especially if you're so far gone, so far off, like for me, stage 4, they wouldn't know what to look for. Anyway, this guy knew what to look for. 2012, I had surgery. Right after that, I had surgery again. 2012, 2013, no, 2012, 2014, the summer, July 2014, I had another surgery for more cleanup of the endometriosis. Yes, I was on that Lupron Depot shot after that surgery. I was on the Lupron Depot shot again after my surgery in 2014. 2014 is when he told me I had to have a hysterectomy. The worst sentence to come out of a doctor's mouth for me was, you have to have a hysterectomy. And I'm like, what does that mean? Because I didn't know for sure. I said, what do you mean? Like, what does that mean? He's like, I'm going to have to remove your ovaries. I'm going to have to remove your uterus and your ovaries. You cannot have children. He was like, basically, I had a frozen pelvis. So everything was stuck together. So you could not really tell the difference between my ovaries and my uterus. Also, my bladder was somewhat caught up in there, and so was and endometriosis was around my rectum as well. Everything was bound together with endometriosis. So as we're preparing for this surgery, we're preparing for the hysterectomy, he also tells me we're going to have to bring in a few people for this surgery because we don't know if there's damage have been done, if the endometriosis has caused damage to anything. So he's asking about how I urinate and my bowel movements. And so I explained to him, to me, I have regular bowel movements. I did notice that when I'm on my menstrual, I have to go a lot, like more often. Like that first morning, I have to go immediately, but I have to go a little bit more often during my menstrual. And he was like, yep, it's because of the endometriosis. And I was just like, what? So he tells me that he's going to bring in a urologist for my bladder. And he's also going to bring in a gastroenterologist for the rectal situation. So when I didn't go to the urologist. No, I didn't have to go to the urologist, but I had to go to the gastroenterologist. So I make my appointment with the gastroenterologist, and he's explaining to me my case. He said, he's worked with Dr. Weiss. He's seen what I was experiencing. And he says, I have to explain something to you. about this procedure. So I'm like, okay. And he was like, so I'm going to have to cut your little intestine and you're going to have an ostomy for for a while. He said for a while. He said, I can't really guesstimate because we haven't really gone in to see what's going on with what the endometriosis has done. So I said, what is an ostomy? So then he brings out shows me a pamphlet. And I start crying. I cried when my doctor told me I had to have the hysterectomy. I cried all through the prep time at him talking to me about what the steps are. But I cried again when he told me about the ostomy. I told my family, I told my dad, I told my aunt, talked to my grandma about it, all that stuff. I even prayed. I was like, God, I've been through so much, and I don't know if I can do with this. And so I just prayed and I was like, God, I know you can reverse it. I know you can I know this. And I'm just praying, believing in God for this miracle and everything. So December 17th, 2014 is when I had to go in for my radical hysterectomy, which is a hysterectomy, total hysterectomy with a bilateral salpino-oophorectomy and loop ileostomy. I had all that done. So he removed my what was supposed to be a 4-hour surgery ended up being an 8-hour surgery. I had my ovaries removed, both ovaries, my uterus, partial vagina, and then the loop ileostomy. So my small intestine was cut so that, and that was the reason why, because I asked why can't it be put back together after this, like if you're removing everything, why can't it be put back together? But my body needed time to heal. So I had all of that done. When I woke up from surgery, I could not feel my right leg, and it was because I had a DVT. The next morning I had a Doppler scan done and I had a DVT blood clot. So yeah, I did not regain the ability to urinate for quite some time. So I was only supposed to be in the hospital for a couple of days, but it ended up being in the hospital for a week and a half, I think it was. So I spent Christmas in the hospital and I left a week. Yeah, I left just before New Year's. Actually, the date, yeah, New Year's Eve. I left New Year's Eve, and I came home with a Foley catheter, and I had my ostomy. My time in the hospital was emotional. It was emotional. It was emotional when I got home because I had nurses to come to the house to help me to check on the Foley and also to help me manage the ostomy. Managing the ostomy was a lot to take in. That first time the nurse came, I couldn't even hold it together because I couldn't look at it. I never looked at it. Even when I was in the hospital and they would change the bag or whatnot, I would not look. I would not look. Of course, they told me, you're gonna have to look. And I said, I just can't. The first time when the nurse had came, my nurses in the hospital were amazing, by the way. I didn't want to not say that. My nurses were amazing. My nurse, when they came to the house, the nurses that came to the house were really, really nice. The nurse who helped me the first time, she was very patient with me and she said, it's okay, cry it out. She was like, you're my first young patient. Like, I've never had a patient this young to deal with the ostomy. Now, mind you, I know all around the world, there are people who have to live with that. There are babies who have to have the ostomies. And so for them, man, I commend you all for your experience and just for what you have to go through. And I feel like all of us collectively who just have these different, who have these certain experiences, we are all just like, we're living with what is our normal, whatever you want to say. So I had my ostomy. Nurse, she taught me eventually, of course, by the next time I learned how to. My aunt also came down from Jacksonville to be with me for that surgery, and she stayed to learn to pay attention as well. So to help me clean myself up, what that looks like, and getting all the materials. I still could not urinate on my own. So eventually when I went to the urologist, I had to go to the urologist to check to see what my bladder was doing. So I had ultrasounds done on my bladder, and my bladder was filling up. I just could not urinate. So I had to do the, what do they call it? I can't remember what they call. It's like this tube thing. I actually should have had my stuff with me. But it's like this tube thing that I had to, it's an intravenous thing that you had to stick into the urethra in order to relieve your bladder. So that's how I was going to the bathroom. I had a bag and I had a little tubey thing. So that was my experience. So here are some of the items that I had to use after my radical hysterectomy with a bilateral oophorectomy and loop ileostomy. As I stated, I had to go home with a Foley catheter, and after meeting with my urologist, I still could not urinate on my own. Or I urinated just a little bit. I didn't really empty the bladder at all. It was like trickles, droplets, and that was it. And my bladder was still full. So then I had to use a intermittent catheter. And this is an intermittent catheter. So there's a long catheter tool, and this is like a liquid. I don't know if it's like a jelly. I can't remember. It's like a liquid to help the catheter be inserted into the urethra. So I would break this and wiggle it around so it can get get lubricated, and then take it out and use it. The piece here would go in to the urethra, and then the urine, the urine would come out the bottom. And that is how I would use that. And I had to write down each time that I would go to the restroom, that I would go to urinate, and keep track of that daily. Then, as I stated, I had a loop ileostomy. So the loop ileostomy was the lower intestine had to be pushed out of my belly, out of the side of my belly. I showed you the pictures, but not of the ostomy itself. And so some of the things that I had to use was, this is an ostomy bag. Some of you are familiar with it or have seen it before. This is an ostomy bag, and it comes with a device here that is stuck onto here like this. This is glue. So when you take this film off, it's actually glue that sticks to the skin. So this is attached to here. This is taken off, and then you attach it to your ostomy or to your stomach. And there's a lot of different gadgets that you use. They have like a skin, it was a skin protector that I used, and there's a powder, I think I used the powder one time and it was not a good choice. You definitely have to clean the area. So they have like, you use an alcohol wipe to clean the skin, wipe the skin, and then a no sting barrier film that they had. You can clean the skin with something like this, a light soap. I actually preferred using soap and water to clean around the outside of my skin, dry it off, and then do what I need to do with the barrier piece. So this barrier stuff, you would stick, not on here, sorry. You would put here. It actually gives it a little bit more adhesive. Did I put it on here or did I put it? I can't remember, but I put it somewhere either on the my skin around, or either put it on here. I can't recall, but I put it on here, which gives it extra adhesive protection. So there's no oopsies. Put that on, and then at the bottom here, this is where it's open, where you would empty, but then you fold it up and then you use a clip to clip it. Yeah. And I had like a little pouch that I would carry with me to work, for a pouch that had gloves, alcohol wipes, all of my little gadgets. So it had all of this. I had body spray. What was it? Victoria's Secret, Bath and Body Works, whomever, body spray to spray. Cause the ostomies are, yeah. So I would carry all of these gadgets with me to work, and this is what I use to help me get through the day. A lot of times I did not like to eat because I didn't want to aggravate the ostomy, but I know I had to eat, so I would eat very little, so that I wouldn't have to really change this much. And yeah, that's how I would keep track of everything. It was a time. It was really I keep this stuff. At first I wanted to get rid of it all, but I decided to keep at least these items because it's a reminder for me of where I came from, like what that time in my life looks like. And I'm just grateful. I really am grateful for the experience. I'm grateful to God for the experience because it taught me a lot about myself, not just resiliency, but also it just taught me to be grateful for the things we kind of take for granted even now, and things that I took for granted, which is using the bathroom on my own. And that was being able to urinate and to do a number two, because for a few months I had to use this. And for a few months I had to use this to be able to urinate. So I think I can't remember how long it was that I was using this. It was a few months though. It was a few months. So if it was January, so it had to be either February or March. I want to say it was somewhere in March, to be honest with you, when I actually did not have to use this anymore. It was March. In April, I had the ileostomy reversal. So, and I got scared with that surgery because I was like, do I have to go back to the intermittent catheter? I was concerned about that, but everything worked out. So that's it. Continue watching the rest of this video. And it was very hard for me. I ended up having to go back to work earlier than even my doctors wanted me to go back to work, but I feel like I was basically being threatened that I will lose my job. I don't know. It was strange. But anyway, But I had great coworkers. My dad would drop me off to work, and I had coworkers that would bring me home because they were going in my direction. They were not too far from where I lived. So that was great. God always had somebody in place and to help me out. But I am so grateful to God for bringing me through this process, which brought me to this moment. It took some time, a lot of therapy to help me process my feelings, process what happened to me. And in 2018, that's when I started Millennial in Menopause. I started on Instagram first, and then I created the YouTube channel. And so here I am. I'm still here. I come on here from time to time, just sharing my experience and sharing my stories, but also just sharing what I've learned through time about surgical menopause, managing it, and the ups, the downs, all of it, all of the good things. So that's my endometriosis story. On this Endometriosis Awareness Month. It has been 10 years, by the way. I don't know if I said that, but it's been 10 years since my hysterectomy as of 2024. So it's been 10 years. And it has been quite a journey, still is. I'm still learning a lot about surgical menopause, a lot about myself emotionally and mentally. Trial and error when it comes to different herbs and different things to take. I do not take hormone replacement therapy because hormone replacement therapy can increase my chances of getting blood clots. So since I had one already, my doctor does not want me to be on hormone replacement therapy. So unfortunately, I have to manage naturally, which is much harder because it's just much harder because it's trial and error when it comes to herbs. You're learning a lot about herbs and different things like that. It's a lot harder than taking like an over-the-counter, or now I won't say over-the-counter, but taking a shot patch or whatever, cream, estradiol cream, all the different things that help. But I've done a lot of videos regarding hormone replacement therapy. I talk about it too on my podcast. So now that my endo story is done, just letting you guys know, if you haven't been watching or been checking me out. So on this channel, I have a playlist, and it is my new podcast, the Menopause Playbook Podcast. And I started that last year, and now I am on season 2 of my podcast. Go check that out. And you can check that out on Apple, Google Play, Spotify, iHeartRadio, Amazon Music, so on and so forth. So check out my podcast. But that is it. And yeah, that's it. And I will be coming back with more videos to talk to you about menopause. If you have any questions, write them in the comments. If you can relate to my story or relate to to just endometriosis in general, share your experience. If you would like to share your experience in the comments, I would love to hear from you all and connect. Until next time, be blessed, bold, and beautiful. Bye.